Hello my friends, with you Yusuf Harafa, a physical therapy student at Heliopolis University. Today we will discuss the knee anatomy regarding the bones, muscles, ligaments and menisci. The bones of the knee joint are the tibia, femur, patella and fibula. The knee joint is a complex joint containing three joints, which are the tibiofemoral joint, the patellofemoral joint, and the tibiofibular joint. The main joint are the tibiofemoral joint, which is a hinge joint, only allows for flexion and extension. Although recent studies has been discovered that the knee joint allow for abduction and adduction, which is valgus and varus stress, and external and internal rotation, which we will discuss in the screw home mechanism later in this video. Let's take a look on the important landmarks at the distal end of the femur. The important landmarks are the lateral and the medial condyle of the femur, which fit in the menisci which lay on the tibia. Also, the popliteal surface from the posterior view, which we have the important neurovascular bundle in this area, and the patellar surface, which have the trochlear groove, which we have a cartilage in this area, is prone to injury in the patellofemoral pain syndrome. Let's take a look on the tibia. The proximal end of the tibia has two condyles, which the meniscus lay on them. The tibial tuberosity is very important to acknowledge because it's a common insertion for the quadriceps muscles. It's inserted in it via the patellar tendon. We have a look on the patella. The patella is a triangular bone, and also it's a sesamoid bone. It serves as a fulcrum for the quadriceps lever system, which lower the force needed for the quadriceps muscle, which lower the ground reaction force for the knee joint. The fibula. Although the fibula is not a true weight-bearing bone, it's very important because it serves as an attachment for an important muscles. As example, for the biceps femoris muscle and the peroneus muscles. Let's take a look on the muscles of the knee joint. The muscles of the knee joint are divided into extensors and flexors. The extensors are mainly the quadriceps muscles. The quadriceps muscles are the vastus medialis, vastus lateralis, and the vastus intermedius. And also the rectus femoris. The rectus femoris is the only muscle from them that act on both hip and the knee. Another muscle which assists in the knee extension are the tensor fasciae lati. Let's take a look on the flexors. The main flexors of the knee joint are the biceps femoris and the semitendinosus and the semimembranosus, which are the hamstring muscles. And the ancestors of these muscles are the gracilis, sartorius, popliteus, gastrocnemius, and plantaris. Let's take a look how these muscles function. They function in knee flexion. The biceps femoris is the lateral hamstring. It has two heads and it makes lateral rotation of the knee. The medial hamstrings are flexors of the knee and also making medial rotation of the knee. Take a look. Let's take a look on the ancestors. The gracilis, sartorius, and gastrocnemius. Also, there is a muscle called popliteus, which we will see its importance in the screw-home mechanism. The screw-home mechanism is very important to knee stability during standing and gait, which are the walking term in the science. The tibia rotates internally during swing phase of the gait. Why? Because the knee is mainly flexed and we are in an open pack position, while externally rotates in a stance phase, which mainly the knee is extended and locked to assume stability in weight-bearing position. The main actor of this mechanism is the popliteus muscle. The action of the popliteus muscle is knee flexion and tibia lateral rotation. Let's take a look on the ligaments of the knee. The ligaments of the knee is divided into extracapsular and intracapsular ligament. What is the intracapsular ligament? Is the ligaments which we found inside the synovial capsule. They are the ACL, anterior cruciate ligament, the PCL, posterior cruciate ligament, the meniscofemoral ligament, and the transverse ligament, which connect the medial meniscus and the lateral meniscus together, the popliteus tendon, and the coronary ligament. The importance of the ACL, the anterior cruciate ligament, it preventing the anterior translation of the tibia and preventing the posterior translation of the femur, while the PCL, the posterior cruciate ligament, prevent posterior translation of the tibia and anterior translation of the femur. Let's take a look on the extracapsular ligaments. The most important extracapsular ligaments are the MCL and the LCL. What that means, the medial collateral ligament, which connects the medial condyle of the femur, let's take a look, to the medial meniscus and the medial surface of the upper part or upper end of the tibia. The LCL, which is the lateral collateral ligament, connects lateral condyle of the femur to the head of the fibula, as presented in this photo. Also, the MCL, the medial collateral ligament, prevents the knee valgus, while the lateral collateral ligament prevents the knee varus. Let's talk about the menisci of the joint. Lastly, the meniscus are very important to fill the gap between the tibia and the femur, to prevent the entrapment of the capsule during knee flexion. Also, it's act as shock absorption and help in body weight transmission. So, what the histology of the meniscus is? The meniscus is a cartilage. It's not a normal cartilage, but it has a nucleus pulposus and annulus fibrosus like the intervertebral disc. Also, it has a periphery. Also, we note the only part of the meniscus that has a blood supply and the sensory supply is the periphery, while the inner parts are having their nutrients transferred by diffusion. There is two menisci, the medial meniscus and the lateral meniscus. The medial meniscus is a C-shaped and less mobile. It's more prone to injury, which the most famous injury of it happened in sudden twisting and flexion, which causing the ACL rupture, MCL rupture, and the medial meniscus rupture, which is called unhappy triad, while the lateral collateral ligament, the LCL, while the lateral meniscus is a circular shaped. It's more mobile. It's not prone to injury as the medial meniscus. That's my take and my explanation of the knee joint anatomy. Thank you for listening and watching to this video.